Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. This is Abdul Wahid. Registration number MLT120192007. BS MLT 8th semester of the Kuwait University of Science and Technology. And today my topic is dengue fever. The topic outlines is dengue fever, types of dengue, transmission, symptoms, diagnosis, prevention, and treatment. So let's start with the introduction. Dengue fever is a mosquito-borne disease caused by dengue virus. It's also known as break-borne fever, is a viral infection spread from mosquito Aedes aegypti, most common in tropical and subtropical climates. Dengue virus is responsible for dengue fever. Is a painful viral disease. Female Aedes aegypti lead to fever flu-like illness. It is also called bone break fever. Around 400 million people affected every year. Dengue is RNA virus. Its outer surface is covered with envelope protein surrounding a lipid bilayer envelope. Inside the envelope is a capsid shell that contains the virus RNA genome. There are two cell surface receptor molecules important in dengue infection. The cognate receptor involved in normal infection and the Fc receptor is involved in a phenomena called antibody-dependent enhancement. There are four types of the dengue which is responsible for causing dengue virus. The first one is the dengue virus type 1, dengue virus type 2, dengue virus type 3 and dengue virus type 4, meaning that it is possible to be infected 4 times. Incubation period. Dengue begins abruptly after a typical incubation period of 5 to 7 days or 4 to 10 days. Symptoms. Most people who get infection won't have symptoms, but for those that do are the following. Usually last for 2 to 7 days, which is high fever, severe headache, pain behind eyes, muscle and joint pain, nausea, vomiting, rash, swollen glands. Severe dengue. Warning signs that doctors should look for include severe abdominal pain, fatigue, persistence vomiting, rapid breathing, blood and vomiting, bleeding gums, restlessness. Transmission. Dengue is transmitted by the bite of mosquitoes Aedes aegypti. An infected mosquito from human blood containing virus can later transmit that virus to healthy people by biting them. There is also evidence that an infected pregnant mother can transmit the dengue virus to her fetus. In rare event, dengue can be transmitted during organ transplantation or blood transfusion from infected donors. Here are the diagrams for the transmission cycle, in which the upper right one in circle in which infected persons with dengue, and secondly another mosquito take blood meal with the dengue virus infection patient. In the third, Infected mosquito bite another normal person, and the last one, that person become infected. And what are the lab diagnoses and how we can diagnose the disease? So here are the four methods. First one, the complete blood count CBC. Second, polymerase chain reaction PCR. Third one is NS1 antigen test by ICT method. And the fourth one is ELISA test for IgM and IgG. CBC complete blood count. And the result will be like the WPC will decrease below 400. Platelet will also decrease below 150,000. Note, in severe dengue RBC count will decrease. Test tube use is ADTA tube. The second one is the PCR test. PCR assay are sensitive, requires specialized equipment and training, not always available in all medical facilities. Test tube use is the gel tube. NS1 antigen by ICT method. NS1 stand for non-structural protein. It allows rapid detection on first day of fever, and it only take 20 minutes to determine the result. Test tube used is the gel tube. ICT device. So here we can see the picture of the device which is used for the ICT method, in which the two parameter is the dengue NS1 antigen non-structural protein, and the second parameter is the dengue antibody which is produced in the body against the virus, and it is IgG or IgM. So here are the positive indication that in the NS1 dengue non-structural protein is indicating positive, because here a line, blue line in the T side indicate the positive, and the another side IgG antibody is also positive. Prevention. So how we could prevent ourselves from the virus or from biting from the mosquito? So wear long sleeved shirts and long pants. Control mosquitoes inside and outside your home. Use mosquito nets and spray. ELISA IgG or IgM. ELISA stands for enzyme linked immune sorbent assay. IgM is indicative of a recent dengue viral infection. IgM antibody are detectable 1 week after infection. The presence of IgG is indicative of a past infection. Test tube is used, the gel tube. Treatment. So how we can treat if we got the infection? So there is no specific treatment for dengue fever. The best option to treat these symptoms are Nixum and paracetamol. Maintenance of the patient body fluid volume by drinking fresh apple juice, sugarcane juice. Patient with dengue should seek medical advice upon the appearance of warning signs. So thank you for listening. Wassalam.